Hi, this is David Sword from the College of Health Professions, Division of Physical Therapy, and the Weight Management Center. I'm a physical therapist and a clinical exercise physiologist. This presentation is on benefits and types of exercise. The objectives of this presentation are to describe or list some of the health benefits associated with regular physical activity, describe two categories of exercise and to give examples of each of these, and to explain the FIT principle as it applies to designing an exercise program. There are many health benefits associated with regular physical activity. Amongst those are improvements in cardiovascular disease risk factors such as high blood pressure, elevated cholesterol levels, poorly controlled blood sugar. All of these seem to be improved by higher levels of physical activity or regular exercise. There's also a decrease in cardiovascular events such as heart attack and stroke, so you're less likely to have a heart attack and stroke if you're more physically active versus less physically active. There's also a decrease in certain types of cancer in people who tend to be more physically active. It's an important part of a weight management program or weight loss program. Results in improvements in bone and joint health. It's certainly very important for people who may be diagnosed or at risk of developing osteoarthritis and or osteoporosis. It can decrease our risk of falling, especially as we age, by helping us maintain higher levels of strength. There are mental health benefits associated with regular activity, including lower levels of depression and anxiety. It tends to result in improvements in quality of life. And last but not least, there seems to be a decreased risk of dying from any cause in people who are more physically active and maintain higher levels of physical fitness. We call this a decrease in all-cause mortality. If you're considering starting a physical activity program or exercise program, this is a simple tool that you might use to determine whether or not becoming more physically active would be safe for you. For the vast majority of us, exercise is safe and the benefits far outweigh the risks. But this simple screening tool will help you determine whether or not maybe you need to speak to your physician prior to starting an exercise program or seek some assistance from a licensed physical therapist or clinical exercise physiologist. The tool consists of 7 yes or no questions. If you answer yes to any of these questions, you may want to talk to your physician prior to becoming more physically active and seek guidance on what types of activities are appropriate for you. The two categories of exercise that we want to mention in this presentation are aerobic activity, sometimes called cardio activity or cardiovascular conditioning exercise, and resistance or strength training. Cardio activity or aerobic activity involves exercises where we engage the major muscle groups, large muscles, and these movements tend to be rhythmical and continuous. So a perfect example would be brisk walking or riding a bike. These activities engage large muscle groups and they're continuous over a period of time. Strength training activities are generally not continuous. We do an exercise, we stop, we rest, and we do another exercise, so on until we complete our exercise session. Resistance or strengthening exercise is particularly helpful at helping us increase or maintain both muscle strength and muscle mass. This can be very important as we age, and in the case of the elderly, this is the one area that is particularly helpful at keeping people independent and helping prevent falls and fractures that we often see occurring in older individuals. Also, resistance training seems to be helpful as part of a weight management strategy, not because we burn a tremendous amount of calories while we're doing this type of exercise, but what it does seem to do is it seems to help us maintain a higher metabolic rate even when we're losing weight. So if we're purposely restricting calories but we're doing strength training, this type of exercise tends to help keep our metabolic rate, or the rate at which we burn calories, elevated even while we're losing weight. And also it protects against the loss of muscle mass. Muscle tissue is functional. We generally don't want to lose muscle tissue while we're losing weight. We want to preferentially lose fat tissue. These are all good examples of aerobic exercise. I mentioned walking and biking. Other activities would be swimming, jogging for some, if that's an appropriate activity, hiking, rowing, really any kind of aerobic type activity that you might do in the gym if you have a gym membership. So an elliptical machine, recumbent cycling, walking on a treadmill, those are all perfect activities, as well as things like dancing or group exercise. For resistance training, you also have many options. So resistance training can be done simply with doing body weight exercises. Some examples are presented on this slide: push-ups, modified push-ups, a sit-to-stand or body weight squat type exercise. You also see exercises being performed with barbells or dumbbells. This is often what we think about when we think about strengthening exercise. And certainly those are good tools to use if we're trying to improve muscle strength. Resistive tubing is also a good tool for us. It's lightweight, it's inexpensive, it comes in various resistance levels, and can be implemented in the home in a small space. So it's a very efficient way to introduce strength training exercises. If you have a gym membership or access to a gym, then you probably have access to a wide variety of equipment, including machines that will target specific muscles or muscle groups. The acronym FIT, F-I-T-T, stands for frequency, intensity, time, and type. As it applies to an exercise program, for aerobic conditioning, the recommended frequency is at least 3 days a week. So a range of 3 to 5 days a week is generally recommended. Intensity level for both aerobic and strengthening exercise, especially if you're first starting out, should be moderate. And we describe moderate as an intensity level that would be associated with a brisk walking pace. In terms of the amount of time dedicated to aerobic activity during a session, the recommendation is working up to 30 to 60 minutes per day of this type of activity. If you're first starting out, you might be shooting for 15 to 20 minutes and then gradually increasing over time. In terms of the type, the ideal type, you have lots of options here. The best type of aerobic activity is always the one that you will stick with or do on a regular basis. If you enjoy walking, stick with walking. If you enjoy biking, that's a great activity as well. You might want to mix it up and get some variety. For strengthening activity, we don't have to do this as frequently. We can get very good benefits with 2 to 3 days a week of strength training. Once again, if you're starting out, intensity should be moderate. You don't want to become overly aggressive with this type of exercise early on, as it can produce a lot of muscle soreness. So it's best to sort of ease into it. Over the period of several weeks, you may gradually increase the intensity. A good starting point would be to select 8 to 10 exercises that are working or addressing different muscle groups. And with those 8 to 10, you should probably be able to get a good all-around workout. Perform the exercises for 1 to 3 sets or circuits, shooting for 10 to 15 repetitions during each set. Once again, the type would be optional. This could include the body weight exercises using resistive tubing, barbells, dumbbells, or perhaps machines in the gym. This is a perceived exertion chart or scale that I think is very helpful in helping people determine whether or not they're working hard enough during an exercise session. Generally, we recommend that during a regular exercise session, the intensity level be somewhere between a 12 and 16 on this chart. That's sort of ranging from fairly light to hard. In general, if you're in that 12 to 13 range, this is an intensity level that's also associated with the description of moderately intense activity. Oftentimes people are interested in what their target heart rate should be while they're exercising, or what their heart rate goal should be during an exercise session. That really depends on the age of the individual, their current level of fitness, their health history, and any medications that they might be taking. This slide demonstrates how we might predict or estimate an appropriate exercising heart rate for an individual. We can use the formula 220 minus age to predict maximal heart rate. As we age, our maximal heart rate declines. So for this individual, a 50-year-old, 220 minus their age equals a predicted maximal heart rate of 170 beats per minute. Because we don't want people exercising at their maximum during an exercise session, we take a percentage of that predicted maximum, in this case 70 to 85%, generally represents an appropriate range. So by multiplying 170 beats per minute by 70%, we get approximately 120 beats per minute. When we multiply that 170 by 85%, that gives us a heart rate of 144 beats per minute. So for this individual, the estimated target heart rate range would be 120 to 144 beats per minute. If they're exercising in this range, they're probably getting very good health benefits and conditioning benefits associated with the exercise. The most important thing during the exercise session is how you feel. So depending just on target heart rate to guide your exercise session may not be appropriate for everybody. The exertion chart shown on a previous slide is a very, very good tool for people who maybe have difficulty palpating their pulse or would prefer not to take the time to measure their pulse during exercise. So although exercise heart rate can be used and the target heart rate range can be developed, it is not always necessary and is probably not the most important factor. This is especially true for people taking certain types of medications called beta blockers. Beta blockers are used to control blood pressure and also other cardiac conditions. One of the things that they do is they lower both resting and exercise heart rate response. So in the case of the individual taking a beta blocker medication, the use of this formula would not be appropriate because it may actually predict a target heart rate range that's well beyond what that person is capable of doing safely. The individual would be better served by using a perceived exertion scale. I hope this information was helpful. Thank you.